I work at the Urban Health Institute, which is part of primary care here at Cooper in Camden and 3 Cooper Plaza, which is right next door to MD Anderson. And we share a lot of patients in common. I'm going to get started and move through the slides here. So I hope in this time that I have with you to address the following topics. We're going to start with just some general heart disease statistics here in the United States. I want to give you a brief overview of exactly what heart disease is. And specifically, as you all are part of the survivorship program, what effects cancer treatment may potentially have on the heart. And in addition, I want to follow up by giving you some tools that we can use to help prevent or slow the process of heart disease. I would really appreciate audience participation. And I'm going to get started with our first question for the group. Where do you think cardiovascular disease ranks as a cause of death in the United States? And you can type your answer in the chat, and Roxanne, you can let me know if there's any responses. If not, just give me the go ahead. Yep, so people are saying first. Well, you all are experts already. Heart disease is the leading cause of death for men and women of most racial groups in the United States. It is what we call the #1 lifestyle disease. And when I say lifestyle disease, I'm talking about things that we do in our daily life that impact our health outcomes. And we'll talk more about that in more detail in just a little bit. Just to give you some statistics on the prevalence of heart disease in the US, if you would imagine every 40 seconds, someone is having a heart attack, and every 34 seconds, someone is dying as a result of heart disease. So about 1 in 4 deaths in the United States every year, close to 660,000 people are from the result of heart disease. Pretty sobering statistics, I think. I'm going to share with you first a map on the prevalence of heart disease in women here in the US, and then we'll do men in a subsequent slide. But as you can see, there's areas in the United States where there's much higher prevalence of heart disease. So the darker red, the higher incidence of heart disease. So you can see there through the lower Midwest and in the South, there's a very high prevalence of heart disease. If you look at New Jersey, where we are sort of in that 285 to 335 women per 100,000 that have heart disease, which I still think is pretty high. It's the leading cause of death for women, like I mentioned previously. 1 in 5 women will die from a complication of heart disease. It's the leading cause of death for both African American and white women. It affects about 1 in 16 African American and white women and Hispanic women. So, you can see the numbers are very, very high. 64% of women who die suddenly from heart disease had no previous symptoms. So I also will hope to leave you today with with knowing the common signs and symptoms of a heart attack or impending heart attack, so you will know how to get treatment as soon as possible. This map probably looks very familiar. This is the incidence of men and heart disease in the United States. It looks pretty similar to the map I just showed you on women. However, the darker red for men is about 300 patients more per each of those colors. So for men, the incidence is much higher. Again, it's the leading cause of death for men. So in women, it was 1 in 5. In men, it's 1 in 4. Again, it's the leading cause of death for most racial groups in the US. And I won't read through all the statistics, but it's very similar. Women, it was 64% who die suddenly. Men, it's 50% who die suddenly of heart disease had no previous symptoms. All right, audience participation question number 2. What do you all think of when you hear the phrase cardiovascular health?
And Feel free to put your answers in the chat box.
Exercise. So I see exercise. Heart health, great. Blood pressure. Heart and blood vessels, eating well, excellent. All right, so I'm going to review with you, and if you took biology in high school, this may look familiar to you, but this is the cardiovascular system. So in the center is your heart. It's a vital organ in the cardiovascular system, if not the most important organ. And the connection that you see there in red are your arteries, and blue are your veins. Arteries carry blood away from the heart out to all of your organs, all the way to the top of your head, to the tips of your toes, and then the blue veins return the blood from those same places back to the heart. The heart is about the size of your fist, so if you were to ball up your fist and look at it, that's about the average size of the human heart. It's located on the left side of your chest, and it's a big muscle that pumps blood through our arteries, like I mentioned, to your lungs and the rest of the body. And then the veins in blue there return it back from the lungs and the heart. Your heart is made up of 4 chambers. The 2 chambers at the top there, and they're labeled the right atria and the left atria. And then in the bottom, you have your ventricles, your right and left ventricles. Between the atria and the ventricles, there are valves, and you may have heard some of these terms before. There's a mitral valve, a tricuspid valve, a pulmonary valve, and an aortic valve. And over time, in some people, those valves wear out and they get them replaced. All right, so this is a very fancy diagram, but it's showing you how blood moves from the body through the heart and then back out to the body. So you can see there in the diagram, and I don't know if you can see my mouse moving, but I'm going to move my mouse through the way the blood moves. But blood comes back to your heart from the largest veins in the body called the vena cava. So there's one big one coming down from your upper body and one coming from your legs back into your right atrium. And then the blood moves through here through the tricuspid valve, and it goes into your right ventricle where it's then pumped out into the pulmonary artery and goes off to your lungs. Then it comes back to the body from the heart, back to the heart from the pulmonary veins to the left atrium, where it's going to then pass through the mitral valve into the left ventricle, get pumped out through the aortic valve into the aorta, which is this big artery here. There's a part of your aorta that carries blood up to your head, and then there's another aorta that you can't see down here that carries blood down to your legs. I had hoped to show you like a little video of the heart as an electrical system as well. So we have this like amazing pumping system, and the way the pumping system works is that there's an electrical impulse that's created, and it starts here at what we call the SA node, and the electrical impulse passes down into this next node, the AV node, and then it goes all around these little tiny fibers around the heart, and that's what causes it to pump. So this is a fancy term called Purkinje fibers down here. But I want you to recognize that the heart, sort of like your home, it runs on electrical impulses or electrical activity. And without that, it would not pump. All right, question number 3. What do you think are the risk factors for cardiovascular disease? Smoking, eating fat, weight, blood pressure, age, gender, and weight. These are all excellent. All right, so I'm going to tell you family history. Perfect. I love technology. So there's some things that we refer to as uncontrollable risk factors. These are things about ourselves as human beings, or things in our environment that we can't really change at all. So we can't change our race. I mean, we were born as we are. And there is a higher incidence of heart disease in African Americans. So roughly 50%, close to 48% of women and 46% of men. Men are disproportionately affected at a higher rate than women up until about age 80, and then women catch up. Our incidence increases with age. So at 20, there's very few people with heart disease, but at 50 to 60, there's many, many more. Somebody mentioned family history. If you have a family history of any type of cardiovascular disease, you do have a higher risk than someone who does not. And specifically in women, women prior to going into menopause, your body makes estrogen, which is considered cardioprotective. So it's beneficial to your heart and cardiovascular system. But after menopause, your body doesn't make estrogen, so your risk of heart disease does increase. And then specific to patients that have had any type of cancer treatment involving chemotherapy or radiation, there are side effects on the cardiovascular system and the heart. And I'll talk a little bit more about that as we move through the presentation. Many of you mentioned these, what we call controllable risk factors, or, I said earlier in the presentation, lifestyle. It's a lifestyle disease. And some of those things that we do have control over are managing blood pressure, keeping cholesterol levels at a good level, not smoking, managing diabetes if we have diabetes, being of a healthy weight, following a healthy diet, not drinking alcohol in excess, and being active. All right, so I think what I'm going to do is move through each of these topics and talk to you a little bit about how they affect the heart and cardiovascular system. So your next question is, what is hypertension? High blood pressure, stress. So it's both of those things. It's the medical term for high blood pressure, and it's defined as the pressure that your blood exerts against the walls of your artery as your heart is pumping oxygenated blood, so blood that has oxygen in it, from the left ventricle throughout the body. 1 in 3 adults, and I'm not sure how many people are on the call, but you could figure it out, divide that number by 3, and that would tell you how many people in this group right now probably have high blood pressure. It's frequently referred to as a silent killer because many, many, many patients have no symptoms until they arrive for an appointment and we check their blood pressure. And I hear this all the time, but I feel fine. My blood pressure is not high. There are some common symptoms, but again, they're very rare, which is headache, blurry vision. Some people feel fatigued. Some people say they feel hot in their face, but majority of people will have no symptoms when their blood pressure is elevated. In addition to that, many people have high blood pressure for years and they're not aware of it. And the reason we want to identify it as early as possible is that if it's untreated, it could lead to complications like heart attack and stroke. It can harm your kidneys, your eyes, or even cause death if untreated. I remember, I always share this little story because when I was in nursing school, I remember we had an instructor who told us about, if you think about blood pressure like a garden hose, and you think of your organs as your newly planted flowers in your garden, you would never think of putting your hose on full blast to water those new little plants or seedlings because it would just damage them and they wouldn't be able to survive. So if we start envisioning our body as our garden and our organs as these little plants that need lots of care, you want to keep your blood pressure low. Blood pressure is recorded as two numbers, and I think sometimes that's confusing for people. That they'll say, "Well, I don't know what my blood pressure is. There's these two numbers, and is the top one better than the lower one? And how am I supposed to know?" So I'm going to give you a quick tutorial. It's recorded as two numbers. Your top number is called your systolic, and that is when the heart is beating or contracting. So it's when the heart is under most pressure. The bottom number is the diastolic pressure, and that is the pressure in the heart when it's relaxing. And we want both numbers to be at goal, because you don't want your heart when it's relaxing to be at high pressure. So below are the American Heart Association and American Stroke Association categories for blood pressure. Most people know that a normal blood pressure is less than 120 over less than 80. And then you can see as you move down the columns there that there's elevated blood pressure, high blood pressure stage 1, and then high blood pressure stage 2. In the elevated and high blood pressure stage 1, most healthcare providers would be recommending some lifestyle changes. So talking to you about getting more exercise, eating a heart-healthy diet to include more fruits and vegetables, to watch your salt intake. When you get into the stage 2 levels, they would start talking to you about starting medications. And then hypertensive crisis, that's a topic for another day, but folks that fall in those ranges will probably be on multiple medications. All right, next question. Can anyone tell me what cholesterol is and why should we care about it? Why is it important to our overall health? It builds plaques. Fat too much can thicken, exactly. Fatty particles that clog your vein. Yes, okay. So I think everybody has the general idea that cholesterol, in simple terms, clogs up our arteries. So let me tell you a little bit more about it. So cholesterol is made in the liver, and in order to live, we do need some level of cholesterol because it's used to build cells and necessary vitamins and hormones in the body. But too much of it, as you'll see in future slides, is not good for us. We also get cholesterol from the diet that we eat, but I want you to go away from this talk understanding that cholesterol is only found in animal-based products. So we as humans make cholesterol, all other animals make cholesterol, and in turn, if we're eating animal products, we are consuming more cholesterol. There's no cholesterol in fruits and vegetables, for example, or in grains. In addition, foods that contain a high level of what we call saturated fat. So a saturated fat, an easy way to remember it is that it's a solid at room temperature. It will trigger our liver to make more cholesterol. So watching your intake of saturated fat is also helpful. And it can affect our arteries, leading to a condition that we call atherosclerosis, which is a fancy medical term for clogging of the arteries. So at the top here, you see a nice healthy artery where the blood is flowing, no problem. It's probably, you would imagine, I don't know, a teenager or somebody in their early 20s. Then as we age, and someone very correctly said cholesterol makes plaques. So cholesterol forms these plaques in the walls of the arteries, which narrows the arteries and makes blood more difficult to flow. And then what ends up happening is blood sticks to those plaques, or the plaques can even break apart and cause a blockage there. And that can lead to a heart attack amongst other complications, which I'll share with you in a minute. If our blood carries oxygen, all of our tissues need oxygen. If we don't have enough oxygen to our tissues, the tissues actually die. And so that's what happens in complications from cardiovascular disease. Here's a very fancy diagram, but in the middle here, you see the same thing that I just showed you on that last slide. So there's a lot of plaque in the wall of this artery, and the red blood cells are forming a clot here, which will eventually block off this artery. And here to the right, you see that it's in the heart. But this can also happen if the artery gets blocked in the brain, which would cause a stroke or what we call a cerebral infarction. Again, here's the heart. This can happen in your kidneys, or it can happen in the legs, and it can block the blood flow of oxygen-rich blood to the legs. So I've already explained this, but if blood flow gets cut off to the muscle of the heart, and the oxygen-rich blood can't get to the tissue in the heart, that tissue actually dies. And so, we tell patients if they're having symptoms of a heart attack, do not waste any time, get to the nearest hospital, because there are procedures that can open a blocked artery and allow that oxygen-rich blood to flow back into the tissue, hopefully preventing tissue death. So some common warning signs, and again, this is not an exhaustive list, and women tend to have slightly different symptoms than men do. But common symptoms would include any type of pain, discomfort, or pressure in the chest, radiating to your left arm, up into your neck. Some people have pain in the back. A lot of people, I did a talk the other night, and one woman shared her story about how she just had a lot of indigestion, and she thought that maybe she had eaten something, but then she started to develop some pressure in the chest and went to the emergency room. Some people have sweating, they feel sick to their stomach, they get shortness of breath, feeling really, really weak and tired. And some people then develop an irregular heartbeat. They can actually feel like their heart is not beating as it normally does. So any of these symptoms, we want you to go to the nearest emergency room. Like I said, there's life-sustaining treatments that they can do to prevent you from losing heart tissue. So there's three main treatments for heart attack. Those include some what we call clot-busting drugs, so medications that can be given to dissolve the clot. Angioplasty, I'll show you a slide in a minute, is where they go in and open the artery, and then there's other surgeries. This is a diagram of what we call a balloon angioplasty. So you can see the clogged artery there. And they typically go in through an artery, either in your vein or your arm, and they feed this little device up into the blocked artery, and then they open it up with the balloon, and they pull the balloon out, and it leaves this stent in place. So the stent helps to keep the walls of the artery open so that oxygen-rich blood can flow through to the heart. There's also heart bypass surgery, and that's exactly what it sounds like. They take an artery or vein from another part of the body and use it to sort of go around or bypass the clogged artery. And in very, very extreme cases, people can go on to need a heart transplant. Okay, somebody mentioned under the different what we call controllable risk factors for heart disease about smoking. As we know, smoking increases your risk for many types of cancer, and I've listed some of them there. We know that it can cause COPD, which is chronic obstructive pulmonary disease, which is inclusive of bronchitis or emphysema. But many people don't know that it can also lead to heart disease. So again, we've been talking about how cholesterol can clog your arteries, and arteries are carrying, if you remember, that oxygen-rich blood out to all of our tissues. But smoking will damage those arteries as well. It also makes the blood a little bit thicker and more likely to clot. And nicotine in cigarettes can increase your heart rate and blood pressure. which increases the stress on your heart. All right, so our next topic is diabetes. What is diabetes? And I'm sure everyone on this call knows someone themselves have diabetes, something with blood sugar, correct. It's also very, very common. Pancreas failure. Uncontrolled high blood sugar. Well, all of you are correct. There are 3 types of diabetes. So someone said pancreas failure. So in patients with type 1 diabetes, their pancreas, which is an organ located in the top of the abdomen, which normally makes insulin, stops making insulin. We consider it an autoimmune disease, meaning that the body itself, for some reason, has attacked the pancreas and now it's no longer functioning. We don't know what the cause is. There's no way to prevent it. It's typically diagnosed in children, although we occasionally see people into their mid to late teens getting diagnosed with type 1 diabetes. And folks that have type 1 diabetes will require insulin injections every day because, like I said, their pancreas is no longer producing any insulin. Type 2 diabetes is the most prevalent in the United States. It's not that your pancreas doesn't make enough insulin, it's just that your body has developed what we call insulin resistance, so it isn't able to use the insulin as well. And just as a quick aside, insulin, our bodies need sugar for energy, and insulin carries the sugar. So if you would imagine, it's like a little transport vehicle. It picks up the sugar and transports it to our cells where we can use it for energy. So if you don't have enough of these little transport vehicles to pick up the sugar and carry it to the cells, you get a buildup of excess sugar in the body. The type 2 diabetes is considered a lifestyle disease. It is more common in people who are overweight and those that don't exercise. And unfortunately, we're seeing it more and more in younger patients, as young as like 8 and 10 years of age, because kids have really become inactive over the last, I'd say the last generation. And then the third type of diabetes, which I'm not going to go into much detail, but just know that there's a third type called gestational diabetes. So this occurs when a woman is pregnant. And women who have diabetes during pregnancy do have a higher risk later in life of developing type 2 diabetes. The good thing about type 2 diabetes is we can manage it with medications, diet, and exercise. And in many cases, if people adhere to the lifestyle changes, they are able to get their blood glucose down to a level where they no longer have diabetes. So we're talking again about how I'm sort of building on this, right? We talked about cholesterol damaging the heart, how smoking can damage the heart, and now how high blood sugar can damage the arteries that are carrying blood to your heart. So again, if we don't have enough oxygenated blood to the heart, it can't work as well. The heart can also get damaged through high blood sugar in terms of the nerves that are innervating the heart, and that can affect how the heart is beating. And again, the most common diabetes complications that most people tend to know about are people losing their vision or having to go on dialysis because of their kidneys, or having to need, unfortunately, amputations of their toes or feet. And this is all because those teeny tiny arteries that are carrying the oxygen-rich blood out to your tissues aren't able, they're damaged, and so the blood can't flow as good as it did before. All right. So this in turn leads me to the next question about, how does obesity affect your heart? So if you're overweight, your blood pressure will go up. Many times people hand in hand with that will develop higher cholesterol levels. And it also causes an increase in insulin resistance, which could lead to diabetes. So all of this leads to more work on the heart. All right, so you have all been through an amazing cancer journey, and I'm so happy that you're now in the survivorship program. So congratulations to all of you. There's been so many advances in cancer treatments in recent years, which has led to wonderful outcomes for patients. I think the thing we sometimes overlook is that the treatment isn't without side effects. Going through treatment is very challenging, and it can be even, there can be even more challenges for people who have pre-existing heart disease, or for those that develop heart disease as a result of the treatments that they've gone through. So both chemotherapy and radiation can weaken the heart muscle, and that's a condition called cardiomyopathy. It can affect the electrical system. If you think back to previous slides where I showed you the electrical system, some treatments can disrupt that electrical system, leading to arrhythmias, meaning that the heart isn't beating as it normally should. And you can also have an increase of blood pressure and cholesterol levels, which could cause blood clotting. So, as this pertains to your cancer journey, it's really important that while people, even prior to going through treatment, and while they're going through treatment, keep their blood pressure and blood sugar and cholesterol under good control, and then following through on that after treatment is over. Again, just touching again on the controllable risk factors that we talked about: managing hypertension, managing cholesterol and diabetes, keeping a healthy weight, exercising, reducing stress, and stopping smoking will help prevent the progression of heart disease. So I'm going to give you some suggestions on exercise. Walking is the best exercise, and it's something that most people can do. If you're not able to walk, I would recommend you try to do some form of sitting exercise. And there's lots of videos out there on YouTube that can give you ideas. Many low impact activities. There's chair yoga. It's just a wealth of information. And whatever type of exercise you do, try to do it for at least 20 to 30 minutes, 5 days a week. At home, I have patients that say, well, I don't really have anywhere that I can walk. It's too cold, or I don't feel safe. So they climb their stairs multiple times a day. They do some dancing. Sorry, there's a lot of background noise with the ambulance. If you're going out, if you park as far away as you can from the entrance of the building, you go to the grocery store, park far away and walk. If you have kids or grandkids, get out and play with them. Just try to incorporate more movement and activity into your daily lives, because I know I can say for myself, we are pretty sedentary. We sit a lot. And I read something recently that said that sitting is like what did they say? Sitting is the new smoking. So it's just as bad for our bodies to sit as if we were smoking, which is really frightening to think about. How do some of you manage stress? I put some answers, some suggestions up here, but I'd be interested to know what do you do to sort of deal with your day-to-day stress? Run or ride a bike. Excellent. So exercise, Bible reading and prayer. Great. So I put some suggestions up here too. So, listening to music, meditate, praying, going to the park, exercising, getting out in nature. Exercise has so many benefits. It helps with stress reduction. It helps with weight loss. It helps people sleep better. And then again, use the internet. On YouTube, there's lots and lots of videos on guided meditation. There's music for stress relief. There's, just other ways that you can help de-stress, because stress is not good on the body. Again, I'm just reiterating smoking, but there's so many benefits to quitting smoking. In 20 minutes, your blood pressure goes down. In 8 hours, your risk of heart attack goes down. And then by the time you're 15 years out, your risk of heart disease is the same as someone who hasn't smoked. So if you are a smoker, I would encourage you to speak with your primary care provider, because there's lots of sort of tools that we use to help people stop smoking. And we know that it's terribly hard to stop smoking. Let's talk a moment about a heart-healthy diet. The sort of key phrase out there now is to eat the rainbow, but try to eat as many different colored fruits and vegetables as you can throughout the day. I don't know if anyone's ever seen the My Plate plan of eating, but basically if you would envision, and I should have included it here, but if you would envision a plate divided into 4 portions, 2 of the 4 portions should be fruits and vegetables, and then a quarter should be your protein, which would be meat, eggs, beans, and then the other portion would be your carbohydrates, which would be like rice, pasta, bread. But the most important thing is just to eat a wide variety of foods. Try to select what we call healthy proteins, legumes, which are beans and lentils. Eat more nuts, fish, and seafood. The whole list is there, and try to minimize the amount of processed foods and added sugars that you're taking in. And if you have high blood pressure, to watch your salt intake. Roxanne has these slides for anyone that's interested, because I've included the references there too. So you could go on the internet and look this information up as well. So these are some examples of commonly sort of prescribed heart-healthy diets. On the left, you see the DASH diet, and DASH simply means dietary approaches to stopping hypertension. At the bottom, you see that the diet is focused mainly on fruits and vegetables, recommending that you get 8 to 10 servings a day, followed by grains of 7 to 8 servings per day. And then as you go up, things decrease in quantity. So low-fat dairy is 2 to 3 a day, seafood, poultry and lean meats between 1 to 2 servings a day, beans, nuts, and seeds 1, and oils 2 to 3. And at the very top there, sweets. The difference between that and the Mediterranean diet is, first, at the bottom of the Mediterranean pyramid is recommending daily physical activity and eating with family. I don't know if anyone's heard of the blue zones, but these are areas in the world where they have the highest population of people living to be over 100 years old. And they've done a lot of research on these communities and found that in addition to eating a very healthy diet, they're very physically active, and they're always connecting. And it doesn't have to be your biological family. It could be your church family, your neighborhood family, just that you're connecting with other people that live more isolated lifestyles don't tend to have as long a life as those that are very well connected with other people. So in addition to eating healthy, we recommend that you get exercise, and that you have some social interactions with others. You can see here again, this one sort of flipped a little bit, more focus on grains, nuts, and seeds, and then the fruits and vegetables are at the second step up there. Eating olive oil, fish, and seafood is very heart healthy. And then as you move up, less sort of dairy products and meats, and at the very top, just like in the DASH diet, are your sweets. All right, so I have come to the end of my presentation. I'm happy to take any questions that anyone has.
Can you give any information about AFib as related to breast cancer and chemo?
Sure, and I will add that I am not an expert in chemotherapy and radiation. I'm a primary care nurse practitioner, but what I do know is that the treatments can affect, like we said, the electrical activity in the heart, which leads to AFib. So AFib is just an irregular heartbeat. It can be managed with medications. It does put you at a slightly higher risk of developing blood clots. So many times patients with AFib are put on either an aspirin or other medications to prevent blood clotting.
Yes, I take a blood thinner and other medications for my calcium channel blockers.
Okay, yes.
Um, but I do have high calcium in my blood, which I have for a number of years. And I know the like letrozole does tend to increase cholesterol and can thicken your blood, um,
Yeah,
and affect some other processes in your body.
your body.
Um,
Yeah. Do you have a cardiologist?
yes,
Yeah, okay. So many patients going through cancer treatment, their oncologist works hand in hand with their cardiologist to make sure that all
right,
those issues are addressed. Yeah.
right, right. Yeah, and I think it's hard to tell whether the AFib is a result of the chemo or not. Uh, I had a reaction from the chemo and ended up in the emergency room with an infection in my colon, and then they told me I had
Mm,
AFib. But
I'm sorry to hear that.
well,
I
it
mean,
happened.
the benefit of chemotherapy and radiation, like I said earlier, is that it saves millions of lives and treats cancer,
Right, right,
and it's not without side effects, unfortunately. Um,
right, right,
but they're
right,
treatable side effects.
right, right. Yeah, and I have another cancer too, so it's kind of I
Oh,
have lymphocytic leukemia and low immune system, so I do infusions every week, which have worked out. I don't get sick anymore.
that's great.
But yeah, so I guess it's just you know a lot of new changes you have to you got to work with.
You have to
So
adapt to them. Yeah, yeah. Well, good luck to you.
thank you.
Rachel, there's another question.
Sure.
Someone asks, is it possible for your heart health to return to what it was before radiation?
Mm,
So perhaps, I mean, I think it depends on where you started. If your heart was healthy, it may be able to get back to a normal health again. If you already had some heart issues prior to, maybe not, you may not get back to perfect again, but you should be able to recover some of your heart function. And it's not that everyone is going to have complications. I just want you to be aware that these are some side effects of cancer treatment, and not everyone will have them.
And going back to that, what what is a good number that indicates that um, it's being controlled?
Are you talking
Can you?
about blood pressure?
Yeah, no, I'm talking about glucose
Oh, your
levels.
glucose.
Mm.
Tech, uh, for most people, in the morning when you first wake up, if your blood glucose is like 120 or less, that's excellent. Same 2 hours after meals. We tend to go by the blood test, the hemoglobin A1C, which is a measure of your glucose control over 3 months. Um,
Right.
and the goal for that, depending on age, is 7% or less. But as you age, um, if you're over 70, it is okay for it to go up a little bit. because the risk of having low sugars as you age is more dangerous than allowing the sugars to be a little bit higher than normal. We worry
Oh,
about
really?
things like dizziness and falls.
Rachel, could you maybe just elaborate a little bit more on the cholesterol, the high versus the low, and which one's the good one and which
I
one's the
sure
bad one?
can. So when you get your cholesterol tested, the test shows many things. It shows your total cholesterol, which should be ideally less than 200. And then it's broken down into your LDL, which is low density lipoprotein. And that's the one everyone refers to as the bad cholesterol. That one tends to be the one that clogs your arteries. That one ideally should be less than 100. If you have diabetes, we like to see it even lower, sometimes, as low as 70 or lower. And then there's the HDL cholesterol, which is high density lipoprotein. That's actually good cholesterol and helps the body eliminate the LDL cholesterol. And then there's a fourth number, which are triglycerides. This is another type of fat that circulates in the blood. And it can be elevated if you have diabetes or people who consume a lot of alcohol. Very, very high levels can be damaging to the pancreas. So your triglycerides, we try to keep those at 150 or less. And there's lots of different medications that we use, to treat cholesterol.
Why? I seem to always have a low HDL.
Mm-hmm.
And I know they say, well, eat almonds or salmon. But is there any other reasons why the HDL would always be lower than, than the standard? I don't know. It's usually like a 42 or a
That's what
40.
yours is?
Yeah, like 42, 43.
That's not terrible. I mean, in women, we say like 50 is good, men 40. The majority of people have low HDL, and part of it for you could be just genetics. And like I said, you
Okay.
can't change that. There's some things in the diet, and the salmon and the almonds are good. Omega-3 fatty acids. So, some people take a supplement. I
I
don't know
do.
if studies have shown
Krill
that it
oil.
really helps. Krill oil. Yeah. I don't know if studies have shown that it is really all that helpful, but in some people it is. So you could experiment and see the next
Yeah.
time you take it, the next time you get your cholesterol checked, if your HDL has come up at all.
Yeah. But it's really not anything to be concerned about if it's like in the low 40s.
No, I mean your doctor's probably recommending that you get it up a little bit through diet if you can, but there's nothing terribly harmful about it being 42. No.
Okay.
Well, I hope it was helpful. I think as healthcare, not just as patients, because you're also consumers of healthcare, that you should know, you should know what your blood pressure is and what your cholesterol levels are and your sugar levels are. And asking your healthcare providers to give you that information when you are
Oh,
at visits
absolutely.
is great.
Yeah.
The other thing too is many health systems now have electronic access to your medical record. And so, with a simple passcode that they give you, you can access your records and have all of that information.
Mm-hmm.
I
Mm-hmm.
do. I do. I look at Cooper changed his format a little bit recently, with
Yes, they
the,
do.
yeah, and I don't know, I kind of like the other one, but I'll get used to this one, but I print all my information going back for years, but now what I have to do is monitor it more closely in terms of how I use that information
Well, I hope
for
it's
these.
helpful.
Very helpful.